Hi, I'm Mark Houston, the host of Doc Talk. This week, we're revisiting a conversation with non-invasive cardiologist Stephen Wasemiller at the Heart and Vascular Institute in Rapid City, who defines the 6 pillars of lifestyle medicine and the roles they play in keeping your heart healthy. He also explores the connection between mental health, social isolation, and the role of spiritual well-being, and advocates for compassionate care and open communication to improve heart health and quality of life. Hello again, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me for just the second time, I've talked with some doctors in the past about how many times they come on, and I'm going to do the Saturday Night Live thing where I get them a jacket for like their 5th time. So you got about 3 more to go, Doctor. Right. Sorry. Dr. Stephen Wasemiller is in, who's a non-invasive cardiologist at Monument Health's Heart and Vascular Institute, specializes in kind of general cardiovascular disease. Would that be fair?
Yeah.
Okay,
yeah,
good.
That's perfect. Yeah.
All right. Mm-hmm. How's everything been to North Dakota lately? Have you been back?
I haven't been to North Dakota lately, but I don't think I'd want to this week.
No kidding.
Although, it's kind of funny how the world kind of shuts down here when the temperature gets to 0.
Yes.
But if that happened at home, I mean, nothing would happen for about 4 months. So,
right.
So it was just kind of this is home. This is.
Well, it is. I know. I remember the first time we talked. You're from North Dakota originally. Mm-hmm. I'm from North Dakota, and you're the only one I've ever talked to so far. It was also
one of the 600,000.
Yeah, exactly.
Right?
That's it for sure. So it's good to have you back, Doctor.
Be back.
Since the last time we talked, things have been. I know at the Heart and Vascular with Monument, you guys have been doing some amazing things there, and it seems like it's all been good.
Yeah, no, it's been super good. We've been super busy trying to expand our practice service lines, and no, it's been really good. In the invasive world with our interventional cardiologists, they've been doing amazing things in the cath lab, and then even in the imaging world, diagnostic world, rhythm world, surgical world, and basically, and heart failure.
Yeah.
We've really been fortunate to put on a very good program in a frankly isolated part of the state. So I count myself be very lucky to be part of this group. It's been amazing.
That's hitting on that. Where we are here in the country, let alone in the state. I've mentioned before that it's so nice that this exists here in Rapid City, so people aren't having to travel.
Yeah.
To go to Denver, Minneapolis, Rochester, any of those places.
And that's the goal. I mean, these folks. I mean, a lot of folks. I mean, they're traveling literally from North Dakota, Bowman, Shadron, Broadus, Sheridan. Like, people are coming in from hundreds and hundreds of miles to come here. So if we were able to offer them a service, that's what we're here for.
Excellent.
Yeah.
Well, it's got to feel good for sure. I know last time we talked, for what we want to cover today, Doctor, we touched a little bit. If anybody wants to go back, you not only were episode 81, but you also were one of the best of episodes in December. What? I don't know if you knew that.
No, I didn't.
You were. We ran, I think, 5 best ofs that we have, and you were one of those in there. So.
Do I get a jacket for that?
You know what? I'm gonna write that down. It was on the thing. So yeah, we can do that.
Perfect.
We'll just get you in one more time, and then we'll get you the jacket.
Love it.
But I remember vaguely kind of talking about what you referred to as the 7 pillars of well-being, which is kind of what we'll focus on with this podcast today. Mm-hmm. How did this come about?
So, for those of you who may not have remembered, I alluded to kind of an organizing body called the American College of Lifestyle Medicine, and they have they actually have 6 pillars of lifestyle medicine that they've touted as things to focus on in terms of making sure that we're taking care of our bodies, we're taking care of our minds, and these types of things have we found to be important, not only in theory, but statistically so, in the studies and trials that we've done about folks implementing lifestyle medicine. So, we always talk about, we always have this concept of what healthy living is like, and what that looks like is going to be different for everybody because we all have a different history with health and our own health. We all have a different experience when it comes to diet, when it comes to exercise and activity, when it comes to mental well-being and that sort of thing. So being able to encapsulate the important features of that in kind of a succinct way, the American College of Lifestyle Medicine has kind of developed this as far as a building tool, or a tool for us as clinicians to use to administer to patients and really kind of help them along in that process.
Is this a recent this college? Is it a recent thing?
I don't know exactly when they formed. I believe it is recent.
Yeah.
They actually have, you can get a board certification in it. And
okay.
It's something that I don't know exactly when they were founded, but it is something that is in the past, several years.
Right.
That's kind of coming into. But lifestyle medicine and the practice thereof has always been part of the practice of medicine. I mean, we as clinicians, that's the first thing that should come to mind when you're approaching a patient with an issue, a medical issue or a medical complaint. That should always be in the back of our minds of how has their lifestyle impacted their life to a point where now they're at a point where they're having pain or symptoms or these types of things. I also talked a little bit last time about some of the studies that have kind of gone into learning more about this, as it pertains to diet and exercise and this sort of thing. And so that's kind of the basis on which this field is built.
Well, it seems like there used to be a time, excuse me, in this medicine where it was you'd go to the doctor, they would diagnose what's wrong, there would either be an operation or medicine, and then they sent you on your way. And now it does feel, for anybody that goes to doctors now, if you go to your primary, if you go to a specialist, right, you are getting more of these questions of what your lifestyle is like, what has led you to this. Is that changing things for you? Are the outcomes becoming better because of that?
Changing for me, I guess I would answer that in a different way. I think when it comes to allopathic medicine, someone who's trained in the medical arts to administer medical care, whether it's medicine or as a procedural type of intervention, in order to become very good and safe at administering that type of care, I mean, it takes a lot of training, a lot of schooling. And so, when any doctor goes through school or training, understandably so, they're being trained to do those things. When I was going through med school, and this is at Loma Linda University, which is one of the quote unquote blue zones, one of the main institutions that promotes health promotion. There was maybe one class devoted to nutrition. If you actually wanted to have a nutrition course, it was an elective. So even in one of the most premier schools for lifestyle-based interventions, lifestyle intervention and healthy living, we just weren't getting that education. We weren't getting the information, that we weren't really given the tools on how to counsel patients about proper diet, about proper exercise. And so I say that just to kind of let folks show their provider a little bit of grace. Next time, it may appear that they're just pushing a pill, so to speak. And granted, by the time you've already come to, us specifically in cardiology, that ship has already sailed. Lifestyle efforts at making things better, at trying to improve your life, those things are still important. But once you've kind of fallen into the realm of, we have a problem that we have to address with medication, sometimes that's the course of action.
Right.
But yeah, no, it's been interesting to kind of see how not only from the medical side of things how things have shifted, but from the patient side of things have shifted. Because more patients are more interested in doing natural approaches to care, which I think is fantastic. But then that puts the onus on us to be the educators of the public, to actually inform them of what is been scientifically proven, what's been evidence-based methods for promoting cardiovascular health.
And there are natural ways to do this, I think, too, right? I mean, there are natural ways that you can educate people. Like you said, the science-based, the facts. Here's things you can do, which I think kind of falls into these pillars that we want to talk about a little bit.
Yes.
Now, you mentioned that there were 6 that they do. Why do I have 7 on my list?
I was going to ask you where the 7th came from, but that's okay. We can talk about them all.
Let's see. Yeah, I have 7.
But that's okay.
Okay, good. All right.
Let's go with it.
I wanted to have a surprise.
And honestly, a lot of that is kind of bleeds together, and it kind of coalesces into the main principles of lifestyle medicine. So I think this can be very fruitful to go over these.
All right.
Sure.
Well, let's start with the obvious one. One of the first ones probably on the list, and that is just your physical well-being, right? How would you explain that, or how would you explain this pillar?
Yeah. So what I would turn that around and say is like, okay, what does healthy look like to you? Okay. Because a lot of people, they see an image of, Chris Hemsworth doing pull-ups, and they're like, that guy's healthy.
Yeah.
But for the vast majority of us, that's not reasonable. Okay. So healthy. So what does healthy mean? Does that mean being able to walk down the street with your dog on a leash and being able to do so without feeling symptoms? Does that mean being able to, climb all the 14ers in Colorado? Does that mean, being able to transfer from your bed to the bathroom without difficulty? And so I think that's an important starting point to really get people to pin down is like, what am I going to define as healthy? And starting there, because when you come into an office and you tell someone, it's like, I want to be healthy, that's like going into your financial advisor's office and say, I want to be wealthy. And it's like, okay, well, first of all, we need to know where we're starting from,
right,
where we want to go, when we want to get there, and how we're going to get there. Okay, and the steps that are going to be involved to get there. And I think that's an important question to kind of define. So how to be healthy. And there's a number of different responses people would say. People would say, well, I want to see my kids graduate.
Yeah.
Okay, that's a goal. I want to be able to move without pain or manageable pain. Okay, that's a goal. And so I think that's an important thing to really get folks to identify what's important to them, because yeah, we can certainly get your cholesterol down. Yeah, we could certainly allow you to live longer, but if we're not accomplishing the goal that you want, which is I want to see my kid graduate, or I want to be able to do these things in life that I haven't previously been able to do, if we're not accomplishing that, then you're always going to have the perception you're not healthy. Does that make sense?
Yes. Oh, totally.
Yeah. So, and that's, trying to, you kind of have to view it from that standpoint. At least I try to in my practice, and in talking to people, understanding where they're at, where they want to go, and how we're going to get there.
What I really heard out of this, Doctor, was I don't have to be a Hemsworth. That's what. Write that down.
Yeah, you don't have to have an Australian accent if you don't want to. Don't worry.
And I suppose with physical, we all know you need to move more, right? You need to get off the couch more. You need to do some cardio. You need to do some lifting. I mean, these are basic things you can do to help that physical well-being, right?
Right. But at the same time, you need to have a reason to get off the couch. You need to have a reason to eat healthy.
Those are good points.
Yeah, for so many years, medicine, and it still is in a lot of ways, medicine has been very prescriptive, meaning I tell you what to do. Okay. And lately, I think it's actually been a very positive trend in medicine where now it's more of a how can we, provider and patient, come up with a plan to work together to meet your goals.
Right.
Okay. Because, what I may want from like the physician side of things may be entirely different from what you want as the patient side of things. So I think starting with that understanding of like, we need to get you having a reason to stay active, having a reason, and allowing you some latitude, allowing you some grace into what diet looks like, into what exercise looks like, into what mindfulness looks like. Like, these are going to be kind of important things if you're going to have any sort of chance at making a lasting change for an individual.
Well, that would kind of roll right into the mental well-being then part of this, correct? Because it seems like you have to have, that does strongly play into how you're going to get the physical well-being too. So the second pillar on this, at least per my list here, is the mental well-being part of it. So there's got to be like that link between mental resilience and just overall health. How do you build that?
Oh man, like mental resilience. Yeah, I mean it's
because that seems to be the hardest part. Is we know we've got to do something, but man, your brain's like, nah, why? Here's the remote. You know.
Yeah. Well, and I'll preface this by saying I am by no means a psychiatrist. I don't pretend to be one. I'm not a counselor. I'm not licensed. But typically when there's some reason why that's keeping us from making a positive change, usually there's some deeper reason that's prohibiting us. Whether it's another bigger issue in our life, whether it's a fear, whether it's some form of anxiety, whether it's maybe you're just too excited and focused on something else that you don't really care what your blood pressure is. Getting to the bottom of what's truly bothering. And if I guess you were to ask, just kind of a general survey of the populace, I bet you most people would just say they're busy, tired, or anxious, or angry too. And there's a lot of theories out there about this. There's a lot of articles that have been written about this. But just kind of understanding where our world has come in the last 5 to 8 to 10 years will kind of give you a little bit more insight into why that may be. So I don't know if you remember, 10 years ago, I never had, at least I never had this sense of just general angst across the entire,
No, exactly.
So, and I mean, there's a lot of theories about that. I mean, you could certainly say a lot of things about why that is, economic reasons, political reasons, socioeconomic reasons. But one thing that I would say that has been much more of an elephant in the room, or much more of a larger presence in our life, literally has been technology and cell phone use. Can you plug books in this?
Absolutely.
So
you bet.
All I will say is, if anyone listening to this has a child that you love in your life, you have to read The Anxious Generation by Jonathan Haidt. This is a very, very eye-opening book for me. It's basically, he's a sociology professor that has researched the impact that social media and digital consumption has had on children, basically since the advent of the iPhone in around 2008, 2007, 2008, I think. And basically, you've seen these rates of depression sky high, the rates of self-harm and social interactions and self-worth that he's seen in his research of kids in this time, and it's very startling. I mean, giving your child access to the free reign of the internet, to the free reign of social media and every type of imaginable personality on there, that's I mean, that's one of the ways that I think that really has impacted the youth for sure, and it's not just limited to youth. I think a lot of social media consumption, social isolation, these other types of things have also contributed to a lot of mental angst and mental health issues.
Well,
and
as a parent, if you've had a kid that grew up during this time, I did. I mean, it's worrisome in some instances because you do all you can. But it doesn't matter because their friends will have it.
Right.
Or other people that, you can't kind of out of your control will do it too.
Right.
And you will see that. So it's not just the kids, like you said.
Yeah.
It can affect the parents, for sure.
It can affect the parents. I mean, and it's not just cell phones. I mean, it's, never in a time have we been in a world where the type of media is so, I don't know, it's so varied. It's a lot of times it's not trustworthy, and it creates a lot of angst in anybody. I mean, you're watching TV and you're seeing images and that you don't know if it's even true, and you don't know what to believe. And so I say all that basically just kind of to summarize, a lot of what we're seeing nowadays, I feel, is stemming a lot from media consumption. And it's hard because it's, the motivation to put out media and have consumers of media. There's a lot of, I don't know how I should say it, but
Well, it's what we're doing right here.
Essentially,
but we are. We're telling the truth. So,
we're trying to help.
Yes, we're trying to absolutely help people get through this. The number 3 one that I have on my list here for these pillars of well-being is social well-being, not the social media side of well-being, but just the interaction physically that I think you need to have with people that honestly, because of social media,
absolutely
is really missing nowadays.
Absolutely.
So how does that play into? I've always been kind of amazed specifically by this pillar because I'm an introverted person in general. I enjoy being alone. I enjoy spending time alone. Drives my wife crazy. She's not that way, but we've got a system. And to me, I've felt fine in that. But there are people out there where loneliness obviously plays a huge part in what specifically can damage your heart in some ways, right?
Right. So this is a stat that the U.S. Surgeon General, I think, has put out a couple of years ago about the loneliness epidemic. It's considered an epidemic now because it's becoming a much more popular thing to talk about, thankfully, and it's getting more attention as it should. But he said that social isolation confers the same cardiovascular risk as smoking a pack of cigarettes a day.
No kidding.
So being socially isolating, not engaging with people on a regular basis, not having conversations with people, basically being isolated. And that could come in many forms. I mean, being alone at home, being alone in a nursing home, being alone in your own apartment. Same cardiovascular risk as smoking in a lot of cases. Now, obviously, how do you... There's different flavors of social isolationism, but, one of the things that, I think a lot of this, I think, stems from that second pillar we talked about of mental health. Again, a lot of that angst, a lot of the fear that you kind of sense nowadays in the population. You also are having a younger generation of people coming up that are scared to have conversations with other people. Like, they don't know how to have conversations. They've only interacted with people through a cell phone or through a social media app. Yeah. And so you have a lot of people now that just really aren't comfortable having conversations with people, and they would rather just stay at home. Yeah, I read another article recently, kind of describing this epidemic, and people. It's kind of funny. We often joke about like, oh, thank goodness my plans were canceled.
Right.
Oh, now I can just sit at home. Which, granted, we've all had those moments, but at the same time, it's kind of a symptom of a different type of problem now, where we used to be a much more social society. You ran into people at the store. You went out to dinner with friends. You had people over to your house for dinner and so forth. Now you just don't have that. Mm-hmm. And I think that does directly affect, mental well-being. So how to address it? I mean, it's gonna look different for everybody.
Right.
But I think the main thing to remember, it is so important to maintain connections, and to do so in a healthy way.
Yeah. All right, let's move on to the next one, Doctor. Spiritual well-being.
Oh.
Which was this the seventh one that wasn't on the list of 6?
No, there was. I'm trying to remember now what it was, but no, I think
this one I thought was interesting too, for sure. Because it doesn't necessarily mean being religious, correct?
Sure.
I think people can be spiritual. I think they can find ways to connect to, whatever they feel comfortable with. Mm-hmm. And it probably is, however you find that is important for your heart.
Yeah, no, it is. And it kind of plays off the social one too, because being part of a religious community or of a like-minded social community has been shown to be beneficial.
Yeah.
I mean, they've studied, longevity studies in individuals, and people do live on average longer than those who aren't engaged, either in like a religious group or even groups that share similar beliefs. Whether it's in the form of a religion or mindset. And so it's definitely an important piece. There's a lot that I talked about this last time, but if you get a chance to watch Dan Buettner's Living to 100 documentary on Netflix, they go through a lot of different communities around the world about the blue zones, about people that live longer lives, and almost every single one in common has either a communal aspect to their life or a shared religious experience to their life. And that's going to look different for everybody. It doesn't mean you necessarily have to go to a church.
Right.
But I think there is something to be said for the mindfulness aspect of our lives, whether it comes in the form of meditation or finding places of solace, and kind of these moments of self-examination. And a lot of it's been said, it's like people don't like silence because it forces people to be with themselves, and a lot of people, that's a scary thing.
It is. Yeah,
and
it can
be. Like I said, so if it is a meditative thing, a reflective thing, a religious thing, it's definitely important.
Well, I think they do that. The spiritual and the social, they do tie in pretty closely. And then you can sprinkle in the mental part of that too, and how these 4 pillars so far all fit together. Mm-hmm. I suppose another big one now would be environmental well-being. That has to affect people as well. Health, happiness.
Yeah.
Whether you believe that things are dire or you don't believe that things are dire. Or could this all go back to the mental thing too?
Yeah, I mean, this is kind of making me think maybe mental and or the environmental and one of the other ones down there. I think it probably was the added one.
That could be, yes.
There's, but no, environmental is, it's an important piece to.
Or are they meaning more of just spending time in nature, just being out of the concrete, of the cars, of the city?
Yeah, and there's definitely benefits to that for sure.
Yeah.
Being engaged in the outdoors. And I think that kind of ties into, if you're outside, you're not on a television, you're not in a car, you're not having fights with your coworkers or whatever.
Right.
And so I think there's definitely a piece to that. But I think, again, it's dovetailing into a lot of these other aspects of well-being that, generally speaking, when we're outside, we are kind of in a quasi-spiritual realm. We are, seeing the grandeur of the world and its beauty and so forth, and being inspired by that. I think being in nature is definitely something that's very, very beneficial. And there has been studies that people have said about the converse. So when you are in a much more busy environment or a polluted environment, that does have a negative impact on your health. Hopefully that kind of answers that.
I think that does kind of tie in with that. That might have been the extra one that was thrown in there. But even these last two pillars, I think, could kind of be tied together too. And it's something that all of us are familiar with. That would be your occupational well-being and your financial well-being. I think those also tied together, but can be separated too. Your occupational, finding purpose maybe in work, maybe a jumping off point for this.
Oh yeah. Man, job satisfaction. How do you tackle that? I mean, again, I am by no means a psychologist or a psychiatrist, and I am not a financial advisor or anything like this. But I think a lot of these pillars we've talked about, occupational, natural, financial, emotional, they all are kind of different paradigms of the same person, the same human. We all have these elements to our lives. We all have to go to our work. We all have a place of employment. We need to subsist. We need to, pay the bills. We need to do so without flying off the handle. We need to do so in a healthy way. We need to do so. There's a lot of these elements to the person itself. And it's hard to come up with one prescriptive approach to all of what we've talked about.
Right.
It's hard to just say, 150 minutes a week, eat an apple every day, don't stress, be sure and relax or pray.
If it was that easy.
All these types of things. Exactly. If it was as easy. But I think, the thing to understand with all of these that we've talked about so far I think the important thing is to first recognize the role that these things play in our lives. So, for instance, in place of employment, I mean, that's where we basically spend a whole quarter of our breathing, waking moments. And if you kind of understand your life in terms of how happy you are at work, do you find fulfillment? Do you find that it's a detriment to you? Is it causing you increased stress? Is it causing you interpersonal conflict? Just being attuned to those types of things and being willing to, ask yourself some pretty hard questions of whether or not, what is my life supposed to look like? How am I supposed to grapple with, my coworkers? How am I supposed to grapple with the fact that it's like, I just don't have, enough to get me through the rest of this month type of thing.
Right.
And really just kind of, giving time and place to the problems that really are in our lives. And I think a lot of patients, that's just what they just need acknowledgement of that. They want somebody to see them and say, I see you. I see you. You are not having a good time right now. You are having problems. And to us, maybe their cholesterol may look fine, their blood pressure looks fine, they're active, they're exercising, but, maybe a friend committed suicide. If that happens, they're not going to listen to you at all during the visit because they have a bigger, more important thing going on in their life than immediately what we're talking about in a cardiology visit. And so, how to address these things. I guess what I'd first state is, understand and give the respect to the problem, the respect that's due, acknowledging the issue and listening. And I think there's a lot that we can learn from other people if we just sit and listen to them, as opposed to just coming right out of the gates with, well, we need to increase this, and we need to do this for you, and we need to do that for you. Because that's how you know a person.
Mm-hmm.
And you can't really treat a person if you don't know them. Otherwise, you're just treating organs, and,
right.
And that's not the business we're in. We're in the business of treating people.
That's about the best way you could have wrapped that up, Doctor, for sure. Because I had some of these other tie-in questions to ask, and as I'm looking at them, I'm thinking, no, that's it. That's the end. That is sitting down as a doctor. You guys do, obviously. You do sit down and listen.
Yeah.
And it's so I guess heartening to see this shift that's happening too. Because I've been going to doctors long enough to have been with the ones that are like, you're what? Okay, here's your thing, get out.
Yeah.
Right?
Yeah.
And I get it. I mean, that was a time, right? And it's just so nice to know that as these things evolve and change, and you learn and you want to help in it, and then it has to make your job easier in a sense, because hopefully, you're spending a lot more time now kind of playing psychologist a little bit too, though, I think. But in the long run, maybe you're not seeing people as much for these heart issues that you might have seen them for, if they can take these pillars and kind of work with them.
Right. In truth, people are coming to physicians or coming to providers for an answer to their health problem, and for them to steer them in the correct way for treatment. That's part of our job. We're responsible. That's our responsibility to the individual. But in as much as that is the case, our job also is to, at least I've taken upon to be my job. I don't know if everybody does this, but understanding what's sitting before you is not a medical problem. It's a person. It's a person with hopes, and it's a person with fears. It's a person with stressors. It's a person that walks the same earth and breathes the same air as you, and understanding that what's important to them should be also important to you. Now, obviously, that doesn't always work in every visit, and there's a lot of times we got to get to the meat of the cardiovascular issue, or whatever it is. Someone having a heart attack, that's not the time to start talking about cholesterol. But as that much is the case, and I think this is kind of just a general philosophy that I've kind of adopted in my practice, is just, we deal with what we have to, in the medical side of things. But before we do any of that, we understand the person sitting in front of us, and that's the most important thing to me.
Is there a place online where people can find this, Doctor?
There is some information about the American College of Lifestyle Medicine.
Okay, American College of Lifestyle Medicine.
So that's online. That's where you can kind of see the 6 other pillars. If I remember off the top of my head, I think it was diet, exercise, avoidance of toxic substances, social connection, sleep, and hydration, I want to say, but I can't remember. But anyway, close enough. But we were in the ballpark. And there's a lot of other resources, about mental health and and those types of things too. I don't have a real exhaustive list or anything to give, but I would just say, if you are having issues, or if there's anything that you'd really want to talk about, start a conversation, because no one's going to know what you're going through until you tell somebody. And if it's on your heart, it's bothering you, we need to help you.
If it's on your heart, it could be your heart.
It could be.
Okay,
Indeed.
so let's get it checked out.
Indeed.
Dr. Stephen Wasemiller, non-invasive cardiologist at Monument Health's Heart and Vascular, specializes, of course, in the general cardiovascular disease. Thanks for coming in again, Doctor.
My pleasure.
You got to do this more, all right? We got to get you at least 3 more.
Oh, that's fine.
I can get you the jacket.
I'm fine. I am happy to be back.
Wonderful.
Thank you for having me.
You bet. Thank you very much, Doctor.